The Miss P Show was brought to you by Orange.
Now, a lot of people wonder, what should I be doing while I'm quarantined? What should I be doing when I'm locked down at home 24/7? Some of those who even usually stay home find it really difficult dealing with the quarantine, but hey, it's only for a short time. So after keeping your body fit, let's talk to a medical doctor who shares the medical implications of the coronavirus, what it really stands for, and we get to know what the myths are. A lot of people talk about hot spaces not being able to keep the virus safe for long, black people not being able to die from this. There's a lot of misinformation on many platforms from mouth to mouth. So we talked to a young doctor who would share the key elements because she has experienced it one-on-one, and how we can stay safe, how to prevent this, and how to keep our loved ones very safe too. Take a look. A gorgeous lady, Alice, medical doctor. You know, we Africans are always proud when we have young, fine women in the medical field, but I'll save that conversation for another day because the brains behind this chick, absolutely amazing. And she's here to help us today understand what we are dealing with in the medical field. Now, hi, Alice.
Hi, Pam.
Thank you. I know it's been a busy time, and I'm sure it's been fairly emotional as well, having to see the world turn over from something we could have never imagined it would be. Now, what exactly are we dealing with? What is the coronavirus? What exactly is this disease?
Well, the coronavirus is a type of virus that we have seen manifest over the years in different forms. This particular coronavirus, again, for some background knowledge, the coronavirus is called a coronavirus because of the shape of the virus.
Yeah.
And this particular virus that we're seeing is one that originated in Wuhan, China. And we've seen that this organism, this virus, has created a disease that we now call COVID-19. So it's been 4 months, roughly 5 months, just about since we last saw it, since we first saw it rather in China, and now it's progressed to a pandemic and has affected the entire world.
Now, the virus spreads from one person to another. There's been talks of it being airborne. What exactly are the modes of transmission at the moment?
What we now understand about the virus is that the virus is spread more by a droplet mechanism, meaning when I cough or I sneeze and I create particles into the air, those particles can become infectious if a person touches their eyes, their nose, their mouth, or they inhale the particles. That's one of the most understood ways that we feel this virus is transmitted. But also, if I touch a particle, whether it's from myself or from another person, and I touch a surface, and another person comes behind me and touches that surface and now touches eyes, nose, mouth, then that's another way that virus can be transmitted.
Now, from a person being infected, what exactly happens from that point to when they start manifesting symptoms or being asymptomatic?
Most people, what we've seen with this virus is that there's about a 2 to 14 day incubation period, meaning from the time when you're first exposed, people will usually show symptoms within 2 to 14 days.
Yeah.
And that's why there was a whole lot of push for self-quarantine when you traveled somewhere and you came back and you may not have any symptoms, which is what we call an asymptomatic carrier. So we allow that person 14 days to manifest, and we can within a reasonable amount of certainty say, well, if you haven't manifested symptoms in 14 days, you likely will not. And I've mentioned a lot about symptoms. Most people are presenting with things like fever and cough, body aches, and also some fatigue. And usually the symptoms are mild to moderate, meaning that something you could probably take care of at home. But unfortunately, there are some people who develop really severe symptoms that require them to be hospitalized.
Now, before we talk about the treatment, when it comes to preventive methods, we've heard hand sanitizers, wash your hands for 20 seconds every 15 to 20 minutes, sneeze, cough and protect yourself so that others don't get infected. Are there any other ways that we could really, stay at home as well? Are there any other ways that we could really prevent this virus from spreading that's known?
I think what you've touched on are all the important things. That's why we do the social distancing. That's why you wash your hands often so that those droplets don't get exposed to other people. You stay indoors. Those are all the things that we can do to prevent the spread of this illness. Honestly, it's just being responsible for ourselves and being responsible for our community as a whole. There is no other thing that you can do necessarily to prevent it, because nobody is immune. It's just we do our best diligence, which is staying indoors and being very careful with hand washing practices and hygiene practices.
Now, as Africans, you know, we always like to find reasons for things and ways to make things a lot more superstitious than they truly are. We've come across some myths saying that the virus doesn't survive in Africa, it doesn't kill Africans. But we've seen quite a few Africans die off of this, even back home. We've heard about the garlic treatments. We've heard about taking lemons. There's so much going about in Africa. Which are those myths you would totally debunk and throw out the window? And which are those you would advise we deal with caution, if at all any?
I think, number one, the important thing to take away is that nobody's immune. No matter where you live in the world, no one is immune to this virus. What we've seen historically with other coronaviruses is that usually the virus is more prevalent in the colder months. So we see flu season is usually somewhere between October and March. So we anticipate, or we've seen in the past that some of these viruses do that. However, we're also seeing that this virus is presenting, and people are being affected in places that have tropical climates. Singapore, Taiwan. It's not flu season there. It's not cold there, and people are still showing symptoms. So the tropical weather part of things, it's truly not a thing that we know just yet. But of course, it's something that we're going to have to live through and get a sense for when the seasons, or what seasons could make this more likely to happen and to present. Now, speaking from the 5G perspective, that's not a thing. And then, so we can just carry on and talk about the next thing. When you talk about herbal remedies and things like garlic and things like lemon, things like honey, turmeric, for example, we have seen anecdotally, there's no medical evidence, the way that we categorize medical evidence in our system anyway, that these things work for sure. However, we know that things like garlic and ginger and honey, turmeric have anti-inflammatory properties.
As a medical personnel, how do you feel when you see your colleagues suffering and dying while trying to help other people come back to normal?
You know, Pam, this is actually something that I've really struggled with. I work primarily in an outpatient setting, and I do some urgent care work, and it's been very challenging for me because there's a lot of guilt around not being able to support my colleagues and not being able to help. But I understand we all have a role. Whether my role is spending time with you and sharing this information, or getting on virtual calls with my patients, providing reassurance, I too have a role. But it's a scary thing. It's a thing that causes a lot of guilt for me. And I want to help and do my best to help, and it's just a matter of finding where your help can be most needed and playing that role and support. If I do the things that I can on the outpatient side, I can prevent people from having to go to the hospital, or having people go to the hospital, and that's a way to prevent my colleagues who are there on the front lines from being exposed any more than they need to be exposed. So it's something I deal with every single day. I manage it every single day, but it's certainly a thing that can and has caused some sleepless nights, but one day at a time is all I can say.
What are some of the lessons you've learned from this phase?
When this first started, when this was happening in China, even I myself, I didn't have the foresight to know that we would be here today. And that was a very humbling experience. So I think in the future, the next time we see something like this somewhere that's localized, or it's just an epidemic in this other country, we need to prepare. And that's something that we didn't do. We didn't prepare. I think we're playing catch up, but it's okay. We're here now. But I think ideally we would have prepared, and would have perhaps done a better job of also preparing other countries that perhaps would be underprepared, right? So thinking about a place like Cameroon, if this thing hits the way it hit the US, that's scary.
It will be crazy. It will be crazy. Well, I stay hopeful that we get through this phase alive, well, and for those who have lost loved ones, I can only pray that they find some sort of comfort and healing. I wish you a lot of strength as you go through this. I imagine that it must be extremely difficult. And I'd like to say thank you, first of all, for putting yourself out there and supporting and helping people go through this. And thank you for creating time for this. And thank you for looking so beautiful, of course. Now, usually I say, I hope you enjoyed this episode, but I hope you were very much informed by the episode we carried out today on how to keep healthy. And of course, looking good is part of feeling good. So put yourself to the test. Wake up every morning, dress up, look good as if you're going somewhere, create an activity, develop yourself. One piece of advice I'll give is respect all the guidelines, but I know that this is going to be extremely difficult for a lot of people in the mental phase. So keep your mind active, learn new things, get yourself involved in family games. There are so many beautiful things that you could be doing in the confinement of your home, but most importantly, share love. Look after those who you really care about, and of course, check on people every single day, because this too shall come and pass. Until next time, you can check us out on Facebook, Instagram, Twitter at The Miss P Show. I'm Miss P and I'm Simply D. Ta-da!